be a teacher.
Actually, saya pernah cita-cita nak jadi pemberita, pembaca berita. I want to be a doctor.
I would say I wanted to be a veterinarian.
Cita-cita tu tak berapa tinggi, tapi sebenarnya terbang tinggilah sebagai pramugari. Tapi dah ke lain jadinya.
Saya cita nak jadi pramugari.
So what did you want to be when you were a kid? I mean, do you remember? Like for me, I remember if my parents or my friends asked me, I wanted to be an astronaut. I know that's very far-fetched, very highly ambitious, but I didn't make it. So if we talk about ambitions and also jobs that take a little bit more courage because it is something different, well, we have three very unique ladies here joining me. Now, before we bring them on, my producer, April, threw me a challenge. That is to do something I have never done before, which is to be in the shoes of a clown. And the assignment was to bring some smiles and cheer to a home for disabled children. Take a look what I went through. And today I'm going to be Molly as the clown joining Bubbles at Pusat Penjagaan Kanak-Kanak Cacat Taman Mega. So let's go in and have some fun. Hi! How are you? That was a lot of fun. Also, it's pretty tiring. And I have to say, good job, Bubbles, for doing such a great job and spreading so much love and joy to these kids here. A lot of fun. Now, in case you're wondering who is Bubbles, well, Bubbles was my tutor. Now, she's a clown and she's joining me here with my two other ladies. Well, good morning.
Good morning.
Now, I'm going to introduce one by one. Now, Bubbles, who is all dressed up as a clown, her real name is Emily Thomas.
That's right.
And I also have Norlia A.K. or Anak Julihi. Anak Julihi, who is a mermaid instructor. Yeah. And finally, Vignes Wari Parneselvam, a palliative care nurse. Right. Yes, happy Labor Day.
Happy Labor Day, right?
Labor Day. Yeah, are we making you work by coming here?
Not really.
No, okay, so we're going to have some fun. All right. Now, Bubbles, tell me, you know, it was so fantastic, all right, first and foremost, to spend the day with you and learning from you because, you know, I realized the job of bringing cheer and smile, it takes a lot of energy. Yes, and you're always so hyped up, you know, so much, always laughing. I mean, how do you do that?
I guess I never really grew up
I'm still a kid inside.
How old are you? In your late 20s or
Mid-30s.
Mid-30s. See? We could never tell because, you know, because you're always smiling and happy. You look so young.
Thank you so much.
So yes. So, thank you. Thank you. So yes, and so you're saying that how do you do it?
I guess at the end of the day, you draw a lot of inner strength from the fact that you are spreading a lot of joy and happiness. We live in a very cold, hard, stressful world. And to see somebody smile, to know that you made somebody's day, you feel like $1 million.
You feel like $1 million. I mean, that must have drove you to do something really different. Yes.
Right.
Now, Norlia.
Yeah.
Dressing as a mermaid. I mean, you can see Norlia has her fins on, has her mermaid suit on. So, you know, to venture into this line, did you ever think when you were a kid that you wanted to be a mermaid?
Yeah, because it's something special. It's like something like fulfill the children's and take this opportunity to love the oceans and love the cultures of the sea.
Right.
Yeah.
So did you, I mean, when you were a kid, when your mom asked you what did you want to be when you grow up, what did you say? Do you remember?
Last time when my mom asked me, I wanted to be a police girl, a policewoman, yeah.
A policewoman?
Yeah, but at last I become a swimming instructor and mermaid instructor.
Okay.
Yeah.
So tell me, I mean, you're saying swimming instructor, so you
Yeah.
have to begin as a swimmer and a swimming instructor, and then you move on to being a mermaid instructor. I mean, what exactly is a mermaid instructor?
A mermaid instructor and swimming instructor is a different one.
Okay.
Swimming instructor is I have to teach the children how to swim more to beginners. So the mermaid is much easier because they know the basic swimming skill. Yeah.
So are you saying that, you know, for children to learn swimming, because it can be a fearful thing, so to lessen their fear, you make it fun by putting on a mermaid suit?
Actually, I will show them how to make the movement inside the swimming pool.
Okay.
So I wear the full suit, and then it's a colorful.
So you have a lot of children learning how to swim?
Yeah, I got a lot, yeah.
So is this a method of actually learning how to swim?
Yes.
Okay, I see. All right, interesting. Now, Vicky, being a palliative care nurse, you know, I'm going to ask you the same question. When you were a child, do you remember what you wanted to be?
Of course, my ambitions are to be in medical line.
Okay.
But haven't decided whether it's a nurses or it's a doctor. Yeah, but end up as a nurse.
Ended up as a nurse.
Yeah.
So being a palliative care nurse, I mean, what do you do?
All right, palliative care nurse means we are community nurses doing home visit and manage the patient's symptoms to improve their quality of life.
Right. Okay. So when you say home visits, I mean, are these cases severe cases or could range from any sort of disease?
It's sorts of any kind of disease. Yeah, it's not only like life-limiting illness, but we do have other kind of organ failure, some genetic disorder as well.
So what different is a palliative care nurse? I mean, you do home visits, so the surrounding is different from being in a hospital. But apart from the location, what are the differences between a normal nurse as opposed to a palliative care nurse?
Palliative care nurse is, as I told you, we are doing home visit and we are dealing with patient symptoms at home. And if you ask me, I'm able to care for patient at home, not only dealing with their symptoms, but also address the needs of the emotion, physicals, and also psychosocial.
I see. So you're a lot more closer to the patient because you're on one-on-one basis. Right, okay.
Right.
So tell us about some of the experiences, perhaps not names, but experiences that you have been through.
Actually, a lot of experience. Yeah, there is a, I mean, common one you will see with patients with difficulty with the patients and the caregivers in the in the community settings, and then dealing with symptoms, especially pain management, and also leading with end of life care.
Oh, I see. Okay. Does it take a toll on you? Because, you know, obviously you're being so close, and if someone is terminal, then obviously it's a very, very sad scenario.
Of course.
Right, okay. So, okay, now coming back to our clown, Emily, now as a child, did you ever think that, you know, it was going to cross your mind to be a clown?
I wanted to be an astronaut just like you.
Yay, yay!
I guess this is as close as I got to it. I can pretend to be whoever I want to be.
Right.
But no, never thought that this is where I would go. But I always tell people, you know, everybody's a natural clown. I just get paid for it.
So you are also having multiple jobs. You're not just a clown.
No.
What is the other part of it?
I'm also a barista, and I run my own events company.
Okay.
We do balloons, balloon products, and I also teach ukulele classes.
Wow, that is quite a lot of jobs to handle. You are obviously a high achiever.
Just very short on the ground.
Just very short on the ground. So now, being a clown, I mean, what do you have to do? What skills do you have to pick up?
Well, it's not really very easy because it takes years of training. First and foremost, you have to do balloons, and you have to learn the balloon techniques and how to twist the balloons.
Like the one that you just gave me on my wrist here?
That's right, that's right. We also have to learn magic tricks. We also have to learn to think on our feet, spontaneous thinking.
Okay.
So it took me about 2 years. 2 years to learn how to do magic. I'm still learning, actually.
Right. And who do you learn from? Is there a clown school?
I had my own sifu. I had somebody who's one of the best in the country teach me.
Okay.
I'm really grateful for him for bringing me down this path.
Right.
And it's an everyday learning process.
Let's just take a look at your physique. I mean, if you can just stand up, Emily. I'll call her Bubbles because that's her clown name. So Bubbles, and I mean, you always have to be dressed up very colorful, right? So you have an entire wardrobe that is catered for clowning?
Yes.
Okay.
Yes.
All right. And you always have the red nose on?
Yes. Got it. We feel very naked without it.
Without it. Now, also doing your own makeup.
That's right.
How long did it take you to learn to do your own makeup?
When I first started, it took me an entire 1 hour. Now I can do it in under 15 minutes.
Right. So what is your, well, kind of common, popular clown trick? If you can actually show us something.
Oh, I actually didn't bring anything.
Oh,
but,
no worries. Okay.
normally, I just like to make people laugh and do the jokes. And according to you, like I said, it's a spontaneous thing, and we react with people in front of us.
Right.
And the jokes are also very tailor-made to the person that we are in contact with.
Do you have to be naturally funny to be a clown?
I hope I'm really funny. But yes, you gotta have a little bit of an extra something there.
And I have to say, Bubbles, because I have not seen many female clowns. So are you one of the very few female clowns in the country?
There are plenty, actually.
Really?
There are quite a few.
Because you're dressed up, you know, and you have your hair up.
Yes.
I don't really notice.
Yes, yes, that's right. But there are quite a few in the country. Yes, we do have.
Okay, so when you go on clowning, people see you as, you know, a non-gender, really, not a guy, not a girl.
Right. That's right. That's the beautiful thing about our job. People don't look at your gender. They look at what you portray. Look at the happiness that you bring forward to them.
I see. Okay. So we're going to allow Bubbles to bring her. Did you bring your bag today? So we're going to have a look inside her bag, her clown bag, what she actually uses to make people happy. So you make people happy ranging from children to adults?
Everybody, yes.
Everyone.
We entertain everyone. We entertain the parents, the kids, and even the waiters and the waitresses. Everybody. It's all about communicating fun with everyone.
And has there been moments, Bubbles, you know, where you feel, you know, some part of you don't want to go out clowning on that particular day, but you have to?
We have we have our ups and downs in lives. We are regular people too. Yes, it's just that when you take on a job, you're committed to it, and when you put on your clown suit, I'm not Emily, I'm Bubbles.
Right.
So, and my job is to bring fun and cheer and love.
Right.
And actually, at the end of the day, after it's done, no matter how bad a day I had, I still come out having a really great big smile on my face too.
Okay, so have a great big smile to our audience here, because we're going to take a big break here. When we come back from break, we're going to be talking about their personal life as well and balancing the acts in their lives. So something from Bubbles before we go to break. Bubbles.
Hi, I'm Sheila Majid. You're watching Bella on NTV7.
Welcome back to Bella Labor Day special. Once again, happy Labor Day, everyone. Now, today on the show, we have 3 ladies who chose different work paths, jobs that are not so ordinary. And why? Is because they choose to make a difference. And they are here joining me. I have Norlia, who is a mermaid instructor, Emily, who is called Bubbles the Clown, and I also have Vignesvari, who is a palliative care nurse. Now, let's just dig a little deeper into perhaps your personal life. Let's get a peek into, your experiences. Norlia, teaching, kids how to swim, what is the experience like?
Experience is fun actually, because I have to take the big responsibility to the how to teach the swimmings, the basic how to swim. So it's fun actually.
Right.
Yeah.
And you are a mother of 3.
Yeah.
How old are your kids? Are they like below 5?
10. Yeah. What is below 5? 10 and 8 years old.
And 8 years old. Did they all learn how to swim?
Yeah.
From
actually.
also learning how to do a mermaid?
Yeah. Myself, we teach them actually. Yeah.
Did they use the mermaid suit as well?
When I my class, then I will bring them along with me lah.
Okay.
Yeah.
So give us a peek into your class. So everybody gets to wear a mermaid suit.
Yeah.
And how young is the person that you would take in?
I got one student is 5 years old. So she's very good, a very talented student. So I will choose biologically also.
Okay.
And then the age is 8 years old.
I see.
Yeah.
So where do you go from being a mermaid swimmer?
It's only definitely aquatic there. There's the swimming pool only.
Swimming pool.
Yeah.
So is it more just for fun? I mean, can you go on and be a performer?
Yeah, actually we got to perform, take the event also.
Okay.
Yeah.
Okay. Wow. So basically, what we see at the swimming pool is children learning how to swim.
Yeah.
So if you put your feet together and if you wear the mermaid suit,
where my mermaid's class, I will wear my mermaid suit like this.
Okay.
And then when my swimming class, I will wear my uniform lah.
And how fun is it, Norlia? I mean, I've never tried wearing a mermaid suit. I mean, like what we see in the visual now. How fun is it to actually be in the pool swimming with a mermaid suit?
Yeah, actually it's very fun and very beautiful. If it's like children like to see the movie, the story about the mermaid tales, right? So when they wear this one, they feel like very special and very special when make the movement inside the underwater.
Right. And we also have a demo here of almost like a half mermaid suit on. That is a different mermaid suit.
Yeah, that is very, very special mermaid tail. That is a silicone.
Okay.
So the heavy is about 10 kg.
10 kg, that suit.
Yeah, when you hold it, it's like it's too heavy. Then after that, when you wear underwater, it's very light.
Right.
Very easy to make movements.
And we know little girls love to be princesses, right? I mean, you talk about pink and princess outfits. They love it, and a crown. And with a mermaid suit, this is something also that they aspire to try on.
Yeah.
So do you have a lot more children who are girls?
Yeah, I got a lot. I got 4 children.
Taking lessons from you.
Yes,
Are there any boys doing the mermaid?
So far, not yet. Hopefully, future. Yeah.
Hopefully the boys will have the courage to try.
Yeah.
Because it's not something for females only, is it?
Yeah, that's right. We got mermaid and mermaid too.
I see. Okay. Now, Bubbles, bringing joy and fun and smiles and doing all this, funny tricks and comedy acts. Is there any particular event that that really spelled out something different for you?
I remember in particular about 2 years ago, I had a call from a client who asked me to do a show for her son who was terminally ill. He had leukemia.
I see.
And I actually do charity shows a lot. I go to GHKL at the cancer ward. I do a lot of shows in the orphanages. So I took on this call, and she was willing to pay me a lot of money actually, because I had to drive all the way down to Johor, Tangkak, Johor. I went there. The boy was 10 years old, and he was told that he had a week to live. It was a private show.
Right.
I did my show for him, and I had to actually every 2 minutes take a time out, go to the bathroom, cry, come back up, because I saw him crying and laughing at the same time.
Oh.
It was really heart-melting. It changed my life. And I cried all the way back from Johor back to KL. And I got a call 1 week later and said that he had passed on.
Well, you know what's so amazing is that you brought at least a moment, a few moments of joy and all that laughter for this kid, which made a difference.
It was really difficult to do.
Must be.
It was really difficult.
And you also have another story, right, that you shared with me, that, you know, donning the clown suit at one particular moment in your life was really tough as well.
It's like after I lost my dad. And the thing about clowns is, when we have ethics, we have a code of conduct. We never turn down, we never not show up for a show.
Okay.
We are punctual, we do what we promise. And I had just lost my dad. And I had already been booked for a show.
I see.
And I had to do a birthday party. And I had to go there and smile and jump around and do the Egyptian dance. There were times where I actually had to stop, go to the bathroom, ball my eyes up, touch up my makeup, and then go back up and like, hey!
Yes.
And
it's never easy.
Oh, no, it's not.
No. Right. Wow. So, you know, for somebody who want to do and try clowning, Bubbles, I mean, you do it on the weekends mostly?
Yes, and weekdays too, in schools, kindies.
So this is a side job.
This is actually my professional job.
Professional job. So you're a restaurateur, you know, you have your own business and you're a clown. Now, if there's somebody out there who is watching this and who wants to try clowning as a part-time job, is there any advice that you can tell them to do it rightly?
Yeah, always draw in happiness. Always draw in your inner kid.
Okay.
It's always about being not about yourself. It's about the other person.
Yes, and we see a lot of beautiful childlike mannerisms from you. Yeah, and you kept it although you are in your 30s. Wonderful. Now, Vicky, being a palliative care nurse, share with us some of the stories that really touched you or really made a difference that you feel.
I have a lot of experience actually, if you want me to talk about. But I feel like it's very sentimental when you are dealing with young kids or babies. It's really touching. And I'm a mom as well, so it's very difficult to go through that moment. But how is the family of the baby or the kids is going through the moment? So as a palliative care nurse, I'm there to guide them, to help them, support them to go through the moment. It's quite tough actually for me to do that.
Is it a 9 to 5? I mean, do you go with a client at their home the whole day, or is it like hourly?
It's normally we are doing about 4 to 5 houses home visits. So each visit depends on the situations. It's about hourly. It depends on what kind of case you are dealing with.
Okay.
Yeah.
So all right. Now we found out from Vicky's friends, with your blessing, Vicky, that how they describe Vicky as a person and as a palliative care nurse. Let's take a look.
Well, she's a really kind person, very kind-hearted person, very caring person, and she really looks out for others. Has been helping me a lot, definitely, by giving me advice, and she's definitely someone that I would look up to.
Yeah, she is a very, very nice mentor. She teach me a lot in knowledge-wise. She will question me, trigger me to think, and also she support me psychologically as well.
Well, Vicky is a very bubbly and enthusiastic nurse. She's very responsible in her role, and she's a good team player, so she holds her team together.
She's a very
good and kindness, but very straightforward. When it comes to loan of equipment, she's very strict, very responsible.
Vicky, you're awesome. Keep it up.
I would just say she's very nice person. Thank you, Vicky, for all your teaching all this while. I wish you all the best for you and your family.
Hi, Vicky. You're doing a good job. Keep it up.
So there you go, some very nice words from your colleagues. Now, I will also ask Alia's friends, Norlia's friends, what they think about Norlia.
Okay, I find Lia is quite patient, and then he's quite skillful, and then of course friendly. So I think he loves the kids, and at the same time he have a mother, so I know she can do to handle all the kids. So that's why I chose her for our team.
For me, she's fine. She's teach very good. And furthermore, even though she's very strict in the water, but once my girls out, they'll be very friendly.
She's actually very passionate in what she's doing, and actually she is very patient as well, because a lot of different kids, they are like all sort of different characteristics. So she's very passionate in teaching them one by one until they actually get it. So I think she's a very patient person.
First time I met her, she's quite good lah. She's very dedicated towards her job, and then I think that she's quite good with the children, and then how she teach and instruct all the children, right? They are quite nice, very helpful and knowledgeable as well. So I see her as a very good figure and a model in our company, and I think that she can rise up very well, and she's good in our company.
If you have time to rest, get a good rest, accompany your family if you can.
I hope to see you at work every day with the smile that you usually carry.
Lia, you can do it. I think every one of us in our company is very dedicated to help you, and vice versa, you can help us back. And yeah, we love you all the way.
Oh, that is so sweet, Leah. Are we bringing some tears to your eyes? Now, what I wonder is that what people would say about Bubbles the clown. Jeng, jeng, jeng. Let's take a look.
The moment we entered here, we saw her. She was so nice, she was so bubbly. She was playing with the kids with special needs so wonderfully and beautifully. I wish her all the luck, and I really feel that she's going to be a very, very good clown.
She's lovely and make children happy, and the children are happy.
The clown is very funny and very active. Yeah, then he's very interactive with the kids. Yeah.
Baba is so active, enjoyable, and I like it.
She is very kind to us and very helpful. She is always smiling and very happy. We are very appreciative to have her with us, and thank you very much, Bubbles. We love you.
Keep them smiling. Keep them smiling, more jokes, and enjoy.
Keep it up. Always keep serving people who are in need, and always be happy. Thank you. Spread happiness.
Keep smiling, and thank you to make our children happy.
Hi, Baba. You must come and visit us again. I love you, Baba. Bye-bye.
Hi, Bubbles. I love you. I love you, Bubble.
Hey.
That is just awesome. So how do you feel, Bubbles, listening to all that?
I'm in the right job.
You're in the right job. See, there's a whole thing about, your jobs have made such a difference to people, and the people that you teach, the people that you care, which is lovely. Before we go for a break, I just want to touch on family one bit. I think, as working women, all full-time here, how do you balance your role, from a 9-to-5 job? Like a lot of mothers out there and a lot of fathers out there, have to come back and care for the family too. So how do you do it, Norlia? What are the principles that drive you?
Oh, I will spend my time with my children. So it means my children, right? I will bring them go to shopping or watch movie when I'm holiday time.
I see.
Yeah.
Okay, so when you spend quality time, it is quality time.
Yeah.
Right, okay. And Vicky, for you?
To be honest, it's not easy to manage. During your working hours, of course, you have your limited time to care for your patient, but I have borderline, which after work is for my family. And during weekends, so that's where I'm balancing. But of course, without my family support, I can't do that.
I see. So when you cut off from work, it's a total cut off.
Yeah.
Do you answer calls, respond to emails?
Of course. If there's a need, of course, I need to do that.
Okay. And what about emotions? Because your job heavily relies on, emotions, and you are caring for people and people who are sickly. So how do you take away from that and go back to your home and your family?
Sometimes it just come along, but since we're already in the field, so we know how to manage it. But if certain things that we couldn't, dealing, then we could, bring up the issue with our team members, because it's related to professionals, so they are the person that we need to brought up. And kind of grieving that we share with the team members, that's helped a lot.
Was there any time that, you felt it was too much?
Yeah.
You have had moments like that? Okay.
Yes.
And how did you counter them?
It's actually, we get to use that. So, just journey of the life.
Journey of life. Okay. All right. Did you have to see, you're saying you have a support group, which is your network of palliative care nurses. Is there a counseling provided for palliative care nurses because of the emotions involved?
It's all our doctors.
Okay.
Yeah.
All right.
They're very good.
I see. Well done, well done. Now, we're going to go for a break, and when we come back, we're going to be learning something from each of these ladies on set. Don't go anywhere. Welcome back to Bella Labor Day Special, and I have with me here 3 ladies who trot different parts, unique parts, not so ordinary parts in their jobs. Now, they have chosen because they love what they do and they hope to make a difference. Now, in this blog, we're going to learn something from all of them. Each of them are going to teach us one thing. Now, I'm going to start off with Vicky. Vicky is a palliative care nurse, and she carries this bag with her all the time, right?
Yes, you're right.
Yeah. So what is this bag? What do you call this bag? Do you have a name for it?
This is the nursing bag.
The nursing bag, okay.
Yeah.
What is inside a nursing bag?
Okay, it actually contains nursing materials, which we bring along to our home visit.
Okay.
Yeah.
All right. So basically, it's all the it's all the materials that you need.
Yes,
so you have like swabs and
dressing sets,
dressing.
Yeah.
Yeah, and a lot of medications as well. Well, that's a big one.
Yeah.
Do you carry this all the time?
Yes.
Okay, let me just feel this. This is like, okay, not too bad. It's about 3-4 kg. Okay, all right. So you have this, and these are things that you obviously use in the line of your work.
Yes.
Okay. Now, you do have something called a syringe in there as well.
Yes, correct.
Okay. Are we all scared of syringes?
Yeah.
But how do you administer something, especially with children and also some adults like myself? How do you do it tenderly?
Okay, when you talk about injection, of course, it afraid everyone. But in our community setting, this is the one that we call it as subcutaneous.
Okay.
This is actually a plastic cannula that is actually inserted through the under your skin, and it's very safe to be used in community setting. It's not through the vein; it won't cause you pain. So this is especially to administer drug or any kind of fluids. Yeah, fluids.
Fluid. Okay.
Yes.
So basically, you use this box to represent the skin layers.
Yes, correct.
Okay, so people who are, when we go to the doctors and they find your vein, as you say, it is painful because they have to hit you and stick out the vein. But with this, it's called a subcutaneous.
Yes, correct.
Okay, and how do you do it? You basically just put the...
Yeah, it's just a plastic cannula. So we are going to insert through you under the skin, either your arm, your thigh.
Oh, so how do you insert that? This is not going to be painful?
It's not really a painful, but it's just you're going to administer in a way of 30 degree, going to insert under your skins, and then we will remove the needle, and so left over only the plastic cannula.
Can you show us how to do it?
I don't have the things prepared today. Yeah, so this is the sample.
Okay.
Yeah.
Okay. All
so
right.
this is actually very easy to manage at home because the family members, the caregiver, are going to deal with it.
Okay.
All right.
All right. So if you don't want to have a syringe, you can ask for a subcutaneous jab.
Yeah, normally we deal with subcutaneous at home. Yeah, for jab as well, but not managing the veins.
That is good to know. That is good. As long as it's very little pain, that is good to know. Now, Norlia, you're going to teach us how to put on this mermaid suit.
All right.
And I'm going to try it.
Sure.
Okay.
You should try it.
So this is my mermaid suit. It actually goes well with my top, with my dress, because it's red. And Norlia, as you say, you know, if I want to learn, you have adults as well coming in with you.
Yes, that's right.
Okay. And how often are the classes?
It's once a week.
Once a week. And where do you
1
teach?
Klang Executive Club.
In Klang?
Yes.
Do you have somewhere closer in Klang?
No, we just only one Klang Executive Club.
Okay, okay. So, you know, to learn how to swim as a mermaid.
Yeah, that's right.
What do you have to have any skills prior?
You have to got at least one skill out of breaststroke or freestyle, 200 meters. You have to swim 200 meters non-stop.
So you need to know how to swim first before you can actually do a mermaid training.
Yeah, that's right.
And what can I be after this, Norlia? Can I go and perform after?
You can. If you qualify to do that, why not? You can do some events.
Okay.
Yeah.
Events,
yeah.
All right, next time I'll try. Okay, so what happens is basically there is a pair of rubbery shoes inside here, and you have to get your size. So mine is a correct size. And this is like the material
it's a fabric material
of a swimsuit.
Yeah.
So it's very stretchy. And you bring it up.
Yes, slowly. Yeah.
Okay.
Nice.
There you go. And then you do.
You should. Yeah. Flip yo.
So this is how you do it. Obviously in the pool.
Yeah. We got a lot of skill underwater.
Okay.
Yeah, it's very, very fun. So you should try this.
I see.
Yeah.
Okay. And finally, with Bubbles. Yes, Bubbles, teach us a trick, please.
I'm actually going to teach you guys how to twist the balloon.
Oh, thank
so
you.
everybody's going to get a balloon. What color is your favorite color?
Okay, I'll go with purple.
It's for you, and this is for you.
Okay.
Now, basically, like this is what clowns do a lot. Do a lot of balloons. So I'm going to teach you how to do the basic poodle. So first and foremost, you got to hold this. This is the head. This is the tail.
Okay.
What we're going to do is I'm going to teach you something called the pinch twist. So you're going to take about this amount, and you're going to pinch it, hold it tight, and take this side and twist.
All right. It's not bursting. That's
it's
good.
not bursting. Yeah, yippee. These are not bad. Good job.
Okay.
And then...
See, she's a nurse. She's very gentle.
She's gentle, that's right. Great. Now what we're going to do is we're going to hold this like that, and we're going to bend it. Can you bend it this way?
Like this?
That's right, that's right. Okay. Correct. A little bit smaller. Bend it a little bit smaller. And now what you need to do is you need to hold this side with this finger and this side with this finger and press it together.
Okay.
Got it? And press it and twist.
And twist.
Okay.
Okay. So what you have here is the very long nose of the dog.
Okay.
Okay, Lisa is probably going to get a very short dog legs. But it's fine. We're going to make the neck very small bubble, pinch and twist again.
Okay.
That's right, pinch and twist. Always remember when you're doing balloons, you always twist in the same direction so it doesn't unravel. Very good, that's absolutely excellent. Wow. And then you're going to do that U shape that I taught you just now again. One more time. A smaller U shape.
Okay, a smaller U shape.
So you're going to one more U shape. That's right.
U shape. Okay.
So this U shape, you hold it again and you twist. That's right. Got it?
Yeah.
Can, Lisa?
Yes.
Okay.
It's correct. Wrong, right?
Okay.
We will get there. We'll get there.
We'll get there. It's all right. It's your first time.
Okay.
And then, so what you've got is you've got the nose, the ears, and the front two paws.
Yes, and finally
the body.
The body. Okay.
So, twist.
Twist. There you go.
And then you're going to get the back two legs again.
Yes.
Another U shape.
Yep.
Pull and twist. And ta-da!
Mine is going to get there. I think mine is...
You went out of...
Completely. Yes, I was listening to my producer. But thank you so much, Bubbles. Thank you for teaching us a trick. I'm going to have...
First time, not bad.
Well done. Thank you to Bubbles, to Vicky, to Leah for joining me here and sharing about your job that makes a difference. And, you know, well done for having the courage to trot the path less chosen. Now, we are going to go. Before that, don't forget to join Daphne Eiking for tomorrow's show, where she'll be talking all about apples. Until then, have a great Labor Day, everyone. Find us on Twitter, Facebook, as well as Instagram, and join in the conversation. Goodbye.